Greetings, everybody. Welcome to TV Skywriter, what I call the local edition. Local meaning Durham, North Carolina. I'm Patricia A. Murray, and basically I have this show during the week because I like to showcase some of the nonprofits, the governmental folks, the folks who can't make it on my Sunday show. Another reason I'm having this particular guest is because senior pharmacists, they're advertisers for the Durham Skywriter. And I did want to introduce you to my advertisers. So Gina Upchurch, Executive Director of Senior Pharmacy, welcome to the show.
Thanks for having me. Appreciate all you do with the Durham Skywriter.
Well, thank you. Well, let's just start this off quickly because our local edition show is limited to 20 minutes because I know people are at their desks working. So we're going to keep this short. But why don't you tell us what you do at Senior Pharmacy?
Okay, I will, but she's hearing static also, just FYI. Lisa is.
Oh, darn. Okay. We did a test run earlier today, folks, and everything was perfect. And now we're on the air with static. So we're going to continue with the interview, even though there's static. I'm going to watch this show after it airs because this show will become a YouTube video. If indeed it's really bad, then we'll just do this again at another time. Let's just go ahead and tell us about Senior Pharmacist.
Okay, great. Well, Senior Pharmacist has been around 20 years, and we do 4 things. We help seniors with limited incomes pay for their medicines. We help them manage their medicines. We have clinical pharmacists that go into people's homes or people come into our office. We're located in the Durham Center for Senior Life, and we work by appointment, and we review medicines and work with doctors to sort of streamline drug regimens. And then we help people find resources so they can stay independent in their homes as long as possible. So we do sort of care management or information and referral on an ongoing basis for the people that are in our program. And lastly, we're the SHIP coordinating site, Seniors Health Insurance Information Program for Durham County. We do Medicare insurance counseling, working with a great staff and lots of volunteers.
Your organization is doing an awful lot. And in fact, with our, in USA anyway, the population is aging. And a lot of the services that you do are, they're really necessary. And I'm wondering, do you think there's a bunch of organizations like yours across the country, or are you extremely unique in what you do?
Yeah, I think sadly we're extremely unique in the way that we bring together 4 things. There are certainly SHIP coordinating sites all around the country, and every county in North Carolina has a SHIP or Medicare insurance counseling site, but they don't have clinical pharmacists necessarily on staff. And the other things we do are fairly unique. There's certainly clinical pharmacists doing medication management, but no other organization that we know about pulls all 4 things together.
Okay. Now, one reason we wanted to come on the show is to talk about long-term care and how many of us, certainly me, we're not ready to even think about long-term care as we get older, and what we're going to do in terms of the services we're going to need, the support we're going to need, and that's something that we wanted to talk about.
Right, absolutely. So let me define what long-term care services and supports are. Well, the vast majority of long-term care services and supports happens in the home, friends and family taking care of people. So it can be in the home, and you can get services in that people may need from other agencies, or it can be in institutions in terms of like assisted living or family care homes or group homes, and then the more, when people need more help, skilled nursing facilities or nursing homes. And so that's all long-term care. In America, about 45% of the dollars goes to institutional care, and only about 45% of the dollars go to home-based services. And one of our arguments is that we need to invest more in home-based services because it's more cost-effective, and it's quite frankly what a lot of people would prefer, staying in their home.
Now, I moved here to care for my aunt. She had Alzheimer's, and this is my opinion. I mean, I don't know, but I think she was much better off because I moved in with her and took care of her until she died. I can't imagine. Now, the social worker did say that if I hadn't moved in with her, they were going to sell her house and sell all her stuff and put her in a, I guess you would call it, I don't know, nursing home or something.
Right, right.
I don't know if she would have lived 6 years more.
Right.
I don't know. What do you think?
Well, I think this is, I mean, you're very amazing, and I remember you and your relationship with your aunt. You're very dedicated to her, and I'm sure she was to you. But you know, we're having more and more women in the workforce, so women tend to be big caregivers, and more people are divorced and having to rely on single incomes, and people don't live near their families anymore. So your situation is fairly common, but also very dedicated and unique. So a lot of people do have to rely on others and other agencies to come in and help them in their home. And one of the things we're arguing is that if you get services into people in their homes and you do have family members and friends involved, it's a much more appropriate way to honor people and to give them services they need in a less costly way. Like just in Durham, for example, well, let me just say, every day in America, 60 and older, 10,000 people turn 60 or older in America. It's called the graying of the population, or the silver tsunami. In Durham alone, this is a crazy statistic. We have 49,000 people that are 60 or older in Durham, and that will go to 70,000 people. So we have 42% growth from the year 2015 to 2025. And we're ill prepared to handle that growth, and we really need to be thinking about it. For example, just right now in Durham, Meals on Wheels, in-home aid services through the Department of Social Services, and Senior PharmAssist, the program I'm with, all have waiting lists, significant waiting lists for services.
So that means in the future, there's going to be quite a bit of competition for those few services, huh?
That's right. That's right. And the other interesting thing, and the reason I wanted to talk about long-term services and supports, the way people are really shocked when they get on Medicare, they tend to assume that Medicare will cover long-term services and supports, but it does not. Medicare is just for certain medical interventions approved, but the way we mainly pay for long-term care in America is through Medicaid. And what we have people do is just spend down all their income, all their assets, until they get poor enough to get on Medicaid. And basically 70% of long-term care, and especially skilled nursing facilities, is paid for by Medicaid. But that's really going to bankrupt future generations if we aren't more proactive in how to deal with long-term services and supports. Only about 6 to 8% of people actually have a long-term care policy anymore. Really? And so we're really not prepared to handle it unless we start doing some different things.
I really think that there is kind of, would you call it a movement of people who are trying to think of ways to keep seniors in their homes? I was told it's kind of like a movement, something relatively new. It
is. And it's called the villages is one way to think about it, or aging in place, or seniors staying put. There are different names for it. But the idea is that we need to meet seniors where they are and where they want to stay, and try to get them the services they need. Of course, not all seniors need lots of services. Some of them want to give back to the community. Many of them do. But for those who do need services, the villages is an example of a way to get them services wrapped around the care that they need. It started at Beacon Hill as one example, but I think they've got it going on in Chapel Hill, and different people in Durham have tried to start something like this. I was recently told that Senior PharmAssist has created a virtual village for seniors with limited incomes that are in our program. Okay. So the idea being that we connect people to resources they need to stay and thrive in their home.
I think that is so important. Like in my aunt's case, she was really lucky that I moved in with her, because she got to go to church every Sunday, just about every Sunday until the end of her life, and she just, was in good yet. But she go to church. I got to take her to W.D. Hill every day for lunch. Yeah. She got to visit her friends, and they visited her. Yeah. Not as often as they used to, but they are getting older too. And she was actually quite happy until she wasn't happy I moved in with her. That was a whole different story. But after she got used to me, she did, I think, have a wonderful life until the very end.
That's right.
I think if more of us could luck out into something like that, I can't imagine that. I wouldn't dare expect my niece to do what I did for my aunt. That was just something I just had to do.
Well, it talks talks about your character, but it also talks about your ability to do that. I mean, with your work, or you making that decision to sacrifice somewhat your own work and career to be with your aunt. And unfortunately, a lot of us, or a lot of people, can't make that decision or don't make that decision. But the idea of supporting things like the villages, and let me just throw this out there. One of the most important things they talk about in this sort of design of keeping people in their home is how important neighborhoods are, and how important it is if you have an older neighbor who may need help after a storm, or who simply needs to be engaged more, or needs help changing a light bulb. A lot of the things that we need to step up and do are not really skilled care. It's just being friendly with your neighbors. Yeah. And but it needs to be coordinated as much as possible. And so I try to, we're really trying to encourage people, if you have neighbors that are older, get to know them. See what they can do for you, what you can do for them. So it could really make a big difference to somebody.
Now, actually, my aunt had an elderly friend. She lived over on Nelson Street. And at the end of her life, her church and her neighbors, and I think her sorority, kind of coordinated her care in terms of, she couldn't cook or anything. So they would take turns taking food to her. And somebody cut her lawn, and I mean, she was able to stay in her house until the very, very end. And I thought that was really sweet how they coordinated that.
Yeah, and there are a lot of online programs, as well as a program called Project Compassion. There are a number of programs that sort of say, okay, who can do what, and how do we coordinate this so the burden doesn't fall, to one person in particular, but that we spread the jobs out so that everybody feels like they can do their part and nobody feels overburdened. And I think the thing that's important too is to know what the senior can give back, because I think, part of living is being able to contribute back. And a lot of older adults can do things. I mean, even if they need help with certain things, can do things that really can contribute to their neighborhood, for example.
Exactly.
Yeah.
Do you think these efforts should be coordinated in a formal sense by a nonprofit agency, or do you think that neighborhoods can be left, to figure it out for themselves, to take care of their seniors?
Yeah, that's a great question. I think it's some of both. Like, I think for some people, neighborhoods and family are already sort of coordinating just fine, and then sometimes step in and help, mediate or help figure that out for people. And then a lot of times, like the help that Senior PharmAssist gives people, it's professional help. So we help people make sure they've got insurance that works well with them, that covers their medicines, their medical care. We know how to find people ramps, to get ramps built on their house, to get them help paying their Medicare Part B and D premium, things that neighbors and family members may not know. So there are also like a number of agencies that can be pulled in helping people remain independent in Durham. I'd say Durham is very lucky. We have lots of resources for older adults. While some of them have waiting lists, we have lots of programs, but not everybody knows about them.
Oh, yeah.
Yeah, we keep being told we're the best kept secret in Durham, which is highly frustrating because we don't mean to be a secret.
Yeah, I think you really hit on something there. We do have a lot of resources here, and there are some agencies that are almost invisible. I hear about them just by happenstance. And I really hope that I can do my part to really showcase these organizations that are helping seniors and people in general. Because our population is, what are we, are you a baby boomer as well? I'm a baby boomer.
I am a baby boomer, yes.
So I heard that we're the largest demographic. I don't know if we still are. But we're certainly going to really tip the balance when we all reach age 65 and up.
That's right. I mean, just that statistic I covered at the beginning of the program, 42% growth in 10 years, 60 and older in Durham. I mean, that means a lot about how we're going to behave as a city and as a community. And several of the county commissioners have gotten on board with this idea of being a senior-friendly city and thinking about transportation, food access, that kind of thing for older adults. And housing is a huge issue in Durham. So a lot of people are thinking about how we age in place in Durham. So there's an exciting group through something called the Durham CRC, or Community Resource Connections. And the county has helped support this program, as well as the Forest at Duke, so that the agencies start working better together. I mean, we don't give people the runaround, but we're working and know each other really well, and sort of act like that village that we're talking about. And it's also called the Partnership for Durham Seniors. Partnership for Durham Seniors is the one that's sort of facilitating this CRC. And Pat, you know this because you worked on the resource guide when we all got together a long time ago. So we're trying to get that online and shared so we can all work better together.
You know, I probably shouldn't say this. I'm going to say it anyway. I like what you just said, but through the years, I have wondered, as a person coming from Chicago, why we don't have a Department on Aging. I guess maybe because of what you just said, we don't really need one. But I was always wondering why the city of Durham, or county, doesn't have an actual department just for people who are aging, so that all of these services are easily coordinated. Maybe I shouldn't say easily.
Wow. Well, that might be a hot topic. We actually do have what used to be called the Council on Aging. They're now called the Durham Center for Senior Life. And so they receive all the, the block grant funding for a lot of the aging services around information and referral, adult day help, senior centers. It's called the Durham Center for Senior Life, but they are not a county agency. They are an independent 501c3 nonprofit. In many counties, they happen to be county agencies and departments, but for whatever reason in Durham, it got started as an independent organization. But they fulfill the basic functions, I think, to some degree, but they can't do everything. So there are a lot of other agencies that exist for different reasons.
Yeah. I'd like to see a bunch of little initiatives to help identify people who might need help. Because of course you don't hear about people who need help because they are invisible. They're not online. A lot of them live secluded. But there are ways to find out who these people are. Like in Chicago, for example, you can register a senior citizen related to you or a neighbor with the city. And what they do, they put this sticker with a specialized number in their mailbox. So that when the mail carrier, if he notices that no one has picked up the mail for a few days, he calls in that number and gives the code to a city employee, and then they check on the person.
Yeah, that's awesome. You had told us about that a few years ago, and I actually told that to Wendy Jacobs, who's one of the county commissioners very interested in this. And I think it does take a village to address this issue, and I think involving postal carriers as well as EMS. I think our local EMS might get more involved and sort of, instead of just going to see someone and then saying, well, you don't need the emergency room, good luck. And I don't think they just do that, but helping that person then connect to resources for whatever problem they're having, that would be huge. So I do think we need to get together around these issues. We had a little over a week ago, we had the first ever aging summit in Durham. It was called the Healthy Aging Summit at the Human Services Building.
Oh, man.
And the Department of Social Services. And it was really awesome. And we heard a woman come talk about the villages and housing issues for older adults out of DC.
Yeah.
We're going to continue that and keep growing the energy for older adults in Durham.
Awesome. Well, we only have a couple of seconds left. So did you want to tell us your contact information and where we can find you, and also how to help people? What I'm really concerned with are a lot of seniors who have bottles and bottles of medications that are unknowingly working against each other without their knowing it. If you could tell us about your contact information and that particular service.
Sure, absolutely. So Senior PharmAssist helps primarily folks pay for medicines if they're at or below about 200% of the federal poverty guidelines, which is an individual with about $2,000 or less in a month. So our services are all free to someone that meets those guidelines. For people with a little bit more money, we have a sliding fee scale for medication reviews, but they just need to contact us, and you have to have an appointment to come see us. And the phone number is 919-688-4772, 919-688-4772, and then you can go on our email or our website to find out more information about all our services, and that's www.seniorpharmassist, PharmAssist.org. And if we don't know exactly what you need, we try to tap you into somebody who does.
Awesome.
And for people who are interested in Durham issues in general, senior issues, there's a group called Partnership for Durham Seniors, and so we'd highly encourage volunteers, agencies, that kind of thing, to join in with the Partnership for Seniors, because we're sort of talking about all these issues.
I think I will rejoin. I would like to, because I was in the mix there while I was hired by the county to put together the senior resource guide. I would like to rejoin you guys. And just to tell a very quick story for caregivers, I was taking care of my aunt. Again, she had Alzheimer's. She had maybe 3 different medications that she was on. I won't dare mention them because I want people to say, "Oh my God, my aunt is taking this." Okay, here's the story. My aunt was on 3 different medications, and she went into a period. Again, she had Alzheimer's, so I had never dealt with that. She went into this period where she was unresponsive. She just kind of sat there, and she ate, when I would push her to eat, and she was just kind of just like this most of the day, just sitting with her head down. And I thought I had lost her to Alzheimer's. I assumed it was just the natural course of things. I had a conversation with Gina Upchurch. Gina asked, "How's your aunt?" And I said, "Well, I think I've lost her. Physically, she seems to be okay, but mentally, she's gone." You asked me what medication she was on. Again, I won't mention what they were. I listed them. You frowned, and you said, "I'll get back with you." And then the next day, I don't know if you remember this, Gina, but you said that you weren't going to tell me what to do exactly, but you felt that this particular medication was working against this particular medication.
Yeah.
And I took her off one of them because it was for incontinence and it wasn't working anyway. So I took her off of that, and she came back. Yeah, I mean, her personality came back immediately. And I'm just recounting this story because sometimes we just assume, especially if we're not experienced taking care of Alzheimer's patients or whatever, that whatever's happening, we just have to accept, and that's that. But sometimes it can be the medication. So I would just say that if you have a bunch of medication or you're a caregiver of someone who's under a lot of medication, to have senior pharmacists check it out. Because sometimes one doctor will prescribe this and another doctor will prescribe that, and unknowingly they'll clash.
Right. Let me add one thing. I'm sorry.
Sure.
So I would also say the most important part of the healthcare team is you, isn't your own advocate or as the caregiver. So make sure that all your providers, pharmacists, physicians know all the medicines, the dosage, frequency that somebody's taking. And just if they try to add something, say, does it go with the things they're already taking? Can you take something away? So put it back to the providers to make sure that they're buying into everything your aunt or whoever is taking. And the last thing is this statistic, which is amazing. For every dollar we spend paying for medicines in the United States, we spend $1.36 fixing problems caused by medication.
Oh, wow.
Yeah, so it's really, really important to understand that medications, we believe strongly, can do lots of really great things to help people stay healthy, but they also can cause harm. And as we age, they're more likely to cause harm. So you really have to be engaged and your own best advocate around your medications. So thank you for that testimony.
Absolutely. Thank you, Gina, for being on the show. Okay, folks.
Thanks for having me.
Absolutely. Hope you enjoyed the show, folks. If you'd like to be a guest on TV Skywriter, my Sunday show where I talk to people around the country, or the local edition, which is aired during the week. Both end up on YouTube, by the way. Just give me a call, 919-809-9682. You can send email to durhamskywriter@gmail.com. Please read the Durham Skywriter, Durham's online community paper. That's durhamskywriter.com. With that, have a great day, and ciao for now. See you, Gina.
Thanks, Pat. See ya.
Bye.